Assalamualaikum warahmatullahi wabarakatuh. Hello, my name is Eka Agustina. I am a research assistant at the Research Center for Care and Control of Infectious Disease Universitas Padjadjaran, Bandung. I'm very grateful for this opportunity to present our research titled Characteristic of Pulmonary Tuberculosis Patients Identified by Active Case Finding Activity in Bandung, Indonesia. We partnered with Bandung Municipal Health Office, University of Otago Medical School, and Harvard Medical School. In this presentation, I would like to explain the background and aim, methods, results, and conclusion of our research. Tuberculosis active case finding, or ACF, is a strategy to detect patients earlier to reduce morbidity, mortality, and limit transmission. In ACF, we followed individual TB patients back to their community. Our research aimed to compare the characteristic of TB cases found through the ACF process with the patients who presented themselves at the healthcare facilities, or passive case finding, PCF. A cross-sectional study was conducted in 6 community health centers, catchment areas in Bandung, Indonesia, between April 2021 to July 2022. We can see the catchment areas map here. From these community health centers and hospitals in the catchment areas, new bacteriologically confirmed TB patients were recruited. They were identified by passive case finding activity. And then their household members and closest neighbors were screened for TB symptoms and underwent a chest X-ray, or CXR. Anyone with a cough or CXR suggestive of TB was asked to give sputum samples for microbiology examination. If the results were TB positive bacteriologically, we categorized them as ACF for patients. Categorical variables were compared using chi-square test. Numerical variables were compared using the Mann-Whitney test. As the result, from 207 bacteriologically confirmed TB patients, 51% were male, median age 33 years, and 172 or 83% were diagnosed using PCF, and 35 patients or 17% ACF. Cases found through PCF had significantly more symptoms than ACF. We can see here from the diagram, patients identified using ACF were less likely to be underweight, 40% versus 56%. Not only less coughing and less fever, patients found through ACF also had less hemoptysis, 5.7% versus 27.3%. Weight loss, less fatigue, and appetite loss compared with those identified using PCF. Shorter cough duration was also found in ACF patients with median 14 versus 55 days compared to PCF patients. Here we can see CXR results of ACF patients were less likely to read as suggestive active TB, 65.7% versus 76% compared to PCF patients. Higher bacterial load was found in PCF patients from smear result than ACF patients. Here we can see the difference. Taken together, this research suggests that tuberculosis patients identified using ACF were less severe and had a lower bacterial load, suggesting a better prognosis and lower risk of transmission. Our study suggested ACF's importance in limiting the spread of TB in the community. Last but not least, we would like to thank all of the study participants, cadres, and local authorities, Puskesmas Caringin, Cibaduyut Kidul, Cibaduyut Wetan, Citarip Kopo, and Sukahaji, also Parahita Laboratory, Emmanuel Hospital, Bandung District Maternal and Child Hospital, Bandung Municipal Health Office, for their participation in our research program. ACF study has received funding from the eAsia Joint Research Program, and also from Indonesian Research and Technology Congressional Research and Innovation Agency. Okay, thank you for your attention. We are now happily taking any input or questions from the audience. Assalamualaikum warahmatullahi wabarakatuh.